Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Nirala Jacobi, who's a naturopathic doctor and internationally recognized expert on small intestinal bacterial overgrowth, also known as SIBO. She's the creator of the SIBO biphasic diet, a resource that has helped tens of thousands of SIBO sufferers around the world. Dr. Jacobi is the host of the SIBO Doctor podcast and the founder of the SIBO Doctor, an online educational platform that includes a practitioner certification program which I recently completed. She's also the medical director of SIBO Test, providing innovative testing options for SIBO and IBS. Dr. Jacobi is known for her systematic and effective approach to diagnosing and treating SIBO and other functional digestive disorders. Having received her naturopathic doctorate in 1998 from the esteemed Bastyr University in Seattle, USA, she brings more than 2 decades of clinical experience and her expertise to her clinic, the Biome Clinic. Welcome to the show, Dr. Jacobi.
Thanks so much for having me.
So you are the SIBO doctor, so we must discuss SIBO today, but I think we should start with the importance of gut health in general. And my listeners know, they've heard this several times from me before, that in chapter 1 of my book, Your Longevity Blueprint, I'm comparing the foundation of the home to the gastrointestinal system in the body. So I'm sure you agree that our gut is our foundation of health. So today's show is going to focus on that, improving gut health for whole body health. But I'd like for you to share more or less how or why. So specifically, how does gut health improve overall body health?
Yes, and it's probably a good place to start there. And as you mentioned, we not just functional practitioners, but naturopathic doctors and practitioners around the world, we believe that the gut is really the root of the tree. And this is often a sort of a metaphor we use that the tree cannot be healthy unless the gut is, or the root is healthy. So that's really the foundation of naturopathic medicine. And gut health is, it's so, I really fell in love with the gut when I became a naturopathic doctor because it involves virtually every other system, the whole complicated symphony of events that takes place in terms of digestion and immune system and your endocrine system, your nervous system. It involves all the other systems just to turn non-self into self, right? So we eat food, and miraculously, we extract all the raw ingredients to power our bodies. So not just that, but we also have this interface where we have this connection to our immune system and how the immune system reacts to potential pathogens and also our microbiome. So it's like you never get bored reading about the gut, right? It's just always an incredible source of amazement of how we actually process foods and extract nutrients and also become more resilient to pathogens. But more specifically, there are, the obvious is if you're not digesting right due to different reasons, SIBO being one. But if you're not digesting your food right, you're not actually extracting those nutrients and ingredients that we know are absolutely essential for health and longevity. Then obviously also the microbiome, which is, for all intents and purposes, another organ. It's actually considered an organ because it releases so many different metabolites and hormones and neuropeptides and different substances that influence how we actually function in the world. So from mitigating, inflammation to blood sugar control to all these different aspects that we associate with health and longevity are influenced really by the microbiome.
So I know you do specialize with digestive disorders, SIBO being one of them. So let's kind of transition to that. So what is SIBO and kind of how does it relate to irritable bowel syndrome?
Okay, so irritable bowel syndrome is the umbrella term given to basically this syndrome of different digestive issues related to irritable bowel. Now, SIBO is considered by some to be about 60 to 80% of people that have been diagnosed with IBS could be considered SIBO. And SIBO stands for small intestine bacterial overgrowth. And it's a condition where bacteria that are normally found in the colon have, for whatever reason, overgrown in the small intestine. And that's really a terrible place to have a bacterial overgrowth, because as I just mentioned, it is the very interface where we absorb nutrients, where we activate our immune system, where all these very, very crucially important functions occur. And so when you have bacterial overgrowth there, you not only have digestive symptoms, but you can also end up with other systemic symptoms.
And I know there are lots of causes, which again, kind of talking before the show, we could do a whole episode just on causes. I had, it took a probably like 17 or 18-hour course of yours. So I know we can't dive into all the root causes, but can you just mention a few of the root causes of SIBO?
Yeah, and this is really my sweet spot when I talk to practitioners and when I talk to patients. It's yes, SIBO is bacterial overgrowth, and you treat it by treating the bacterial overgrowth. But more importantly, you must address underlying causes to really cure it for good, because it is a chronically relapsing condition for some. So, what I've done is I've sort of categorized all the different groups of causes, because it's not just one cause, right? It's a lot of different things that can lead to bacterial overgrowth. So if you think about motility disorders, right, anything that impacts the normal motility of the small intestine, and you normally, under normal circumstances, have several different mechanisms to clear out the small intestine from potential bacterial overgrowth. It's just a natural either cleansing wave or vagal toning, or vagal influence that causes normal contractions. So lots of different ways that the body helps to clear the small intestine, because it's so vitally important that bacteria don't overgrow. So these kinds of safeguards are in place that the body has. So if you have a condition that affects motility, such as hypothyroidism, or having had a case of food poisoning before that damaged your what's called migrating motor complex, which is a really specific form of motility in the small intestine, or you have mold illness that's causing gut toxicity and slow motility. So many different causes that cause slow motility. So, and for each cause, it's a different treatment. And then you have also another category of underlying cause, which I sort of call digestive deficit, which some of the first line antimicrobial aspects or shields that the body has in place are deficient. So for example, hydrochloric acid, which is stomach acid, and it's sort of like the vat of acid that kills bacteria that are found in food, or oral bacteria. Are also killed by that. And if you are chronically stressed, or you have a genetic condition that causes hypochlorhydria or low stomach acid output, then that is compromising your ability to kill bacteria, and other digestive juices as well. Bile and pancreatic enzymes also function in that capacity. So, and then the other one is obstruction, what I would call obstructive situation, which is not really an obstruction of your small bowel, but it's an anatomical deviation from normal because of scar tissue. So let's say you've had a hysterectomy, or you've had your gallbladder taken out, or you had any number of abdominal surgeries or endometriosis. And it's a condition, or when surgery happens or endometriosis happen, it triggers adhesions and scar formation, and that can then attach on the outside of the small intestine and create what I call a kink in the garden hose. So things are not moving effectively through the small intestine, and also leave bacteria in the small intestine. So these three different categories of causes encompass a huge number of different conditions. And that's why some people, they're sort of in this merry-go-round of treatment and relapse, and never really get to the bottom of what's causing their SIBO. And that's been really my mission with a lot of the trainings I do.
What about medications? Can medications also contribute?
Yes, so these are mostly, substances that slow motility. That's for the most part. Any, your opioids and certain painkillers and morphine and those kinds of things can really affect motility. But that's more minor, because it's a temporary situation for many people, and that can be remedied by just replacing that medication with something that doesn't cause that.
Sure. Can you differentiate different types of SIBO? And then we can kind of get into testing as well. But I know it's not just like you have SIBO. There are different types of SIBO that can be treated a little differently. So can you kind of differentiate those for us?
Yeah, sure. So what we know right now is that there are three types of gases that are produced by different organisms. So you have your main hydrogen producers that are typically produced by a specific type of bacteria like E. coli and Klebsiella. And then you have methane gas that's produced by methanogens, which is a different type of organism. And then you have hydrogen sulfide gas, which is produced by hydrogen sulfide producers like disulfovibrio and fusarium. And so these types of gases it's important to know what kind of SIBO you have, because each type of gas requires a different type of treatment. Hydrogen sulfide and hydrogen are similar in treatment, but the archaea or methanogens require a slightly different one. So typically when we see hydrogen dominance on a breath test, or a higher hydrogen than anything else, it usually means that the person has either diarrhea or a normal stool pattern, typically. With methane, we see almost always constipation. And then with hydrogen sulfide, which really I don't even often talk about. I mean, well, I do talk about it, but because there's only one lab in America that tests for this, it's difficult, because I wish there were other labs to really corroborate some of the evidence of and the efficacy of that type of testing, because we just don't have enough labs available to offer that test. So usually I just talk about hydrogen and methane because they're very easily accessible through testing. And so then when you talk about different types of treatment, it's pretty easy. So it's either hydrogen or a mixed hydrogen methane, or it's methane dominant, what we now call IMO, or intestinal methanogen overgrowth, which typically causes constipation.
Yeah, thank you for differentiating those symptoms too. What about other clues in general? I know you mentioned a lot of clues in your course that could cue a practitioner into knowing, that their patient has SIBO. So for listeners, what are some of those clues?
Yeah, so for example, if the person is, eating a lot of or getting a lot of symptoms with a high fermentable fiber diet, so what we call the FODMAP diet, if you are eating a lot of very healthy, wonderful vegetables, but you're getting very gassy, very bloaty after meals, that may be a clue. Or if the practitioner actually prescribes a type of fiber and the person reports more bloating immediately after taking it, or prebiotic kind of bloating. So that's a big clue. Another one is if you have been prescribed antibiotics for an unrelated condition like sinusitis, but lo and behold, your IBS symptoms resolve or improve greatly. That's also a clue. So sometimes those are not necessarily diagnostic, but they're great little light bulbs for the practitioner to help them to consider testing for SIBO, which is just so easy these days.
Yeah, I like those. I know you also mentioned, symptoms that worsen with sugar alcohols. That was me. That was kind of how I ended up finding that I had fructose intolerance and SIBO. And then you also, I think, mentioned something like patients who are diagnosed with celiac, who go gluten-free, who continue to have symptoms. That's a cue there's still something else going on that hasn't been found and treated.
Yeah. And that's probably the broadest of all of those clues, because, you could have other reasons. You could have LIBO, right? LIBO is large intestine bacterial overgrowth. And typically the treatment is not necessarily very different, but I think the dietarily, we would probably treat that a little different.
Yep. What are some other conditions that SIBO is associated with? I was really shocked to hear these in your course.
Yeah, so these are not conditions that have caused SIBO, or but there are a number of conditions that are just highly associated with SIBO, meaning that they're often seen together. So if you're a practitioner listening to this, and you have somebody, for example, with acne rosacea, that's actually one of the 4 that I would consider test for SIBO, regardless of the degree of digestive symptoms. because it's so highly associated with SIBO. Another one would be interstitial cystitis.
Yep.
Or fibromyalgia, and now as the years go on, we have hundreds of conditions that are associated with SIBO, varying degrees, but also things like
Shoot, you froze. I don't know if you can hear me, but you are frozen. Shoot, shoot, shoot. I'll type in the chat here. You're back. Sorry, you froze.
Yeah, where I left off. Where did I leave off?
Well, so I did get the conditions associated with SIBO. Well, now you're frozen.
Okay.
I think you're
All
frozen
right.
again. You're not moving.
Do you want me to turn off my video? Or I have good power, so I don't know what it is.
You're back now. You were frozen for a bit, but as long as the audio keeps going, we'll be okay. So
Do you want me to turn the video off?
Shoot, you froze again. Does that, I mean, in your experience, does that help or?
Yeah, it usually helps a bit, you know.
Does? Okay.
I'm not sure if it's because there's a storm coming in.
Sure, that's interfering with internet or something. I mean, I'm happy to, yeah, we can shut up our video and keep talking. I don't know how to tell if you're there or not when I can't see that you're frozen. But I guess if audio disconnects, then I know you're gone.
Yeah, I just, let me try this other one. Let me try the Can you hear me now?
Yeah, yeah.
Okay. I just switched networks, so let's try that. I think
Okay.
You can put your video back on.
Fancy. So yeah, I mean, it still says it's recording, so hopefully nothing's disconnected on my end, but okay. Well, you already mentioned.
Wait, I'm going to turn off I'm going to turn it back off because you're frozen. Your video is frozen. I can hear you, but your video is frozen.
Okay.
All right.
We'll just keep talking here. So you already mentioned some of the symptoms of different types of SIBO, but can we expand on some of those, just general symptoms that patients with SIBO may be experiencing?
Yeah, so it's pretty classic IBS symptoms. And I would say top of the line would be bloating after meals, and pretty soon after meals, not just hours after meals, but like 10, 20 minutes after meals, your bloating starts. That would be probably the primary symptom. And then we have a lot of bowel issues in terms of either too fast or too slow, constipation, or loose stools. Then we have also abdominal hypersensitivity or abdominal pain. And sometimes that's gas pain, sometimes that's just the hypersensitivity. Then we also have a lot of upper gut symptoms like reflux or gastritis. Those types of symptoms are really, really common as well.
Sure. What if someone can't tolerate sulfur-rich vegetables and foods? What could that tell us?
Well, that can be, that's a really complicated situation because it can be an overgrowth of sulfur. Confusingly, we call them sulfur-reducing bacteria, but that's a chemical term. But they're sulfur or hydrogen sulfide producing bacteria. Sometimes when they're overgrown, it can mean that the patient is sort of sensitive to sulfur containing vegetables and foods in general. But it is a more complicated issue because sulfur is such an important aspect of everything from connective tissue integrity to detoxification to brain health. So it's a very, very important mineral. And it's we look at complicated pathways when we're looking at things like thiol sensitivity and sulfur sensitivity in general. But just simplifying it for the gut symptoms would be to look at hydrogen sulfide producing bacterial overgrowth.
Sure, sure. Okay, let's transition to testing options. You kind of already alluded to the breath test, but can you kind of break that down, how we do the breath test, why SIBO can only be tested in the breath, and then kind of what results we're looking for a positive finding on that?
Okay, so the breath test is based on the fact that when you consume a test substrate like lactulose or glucose or fructose, these substances are very readily fermented by gut bacteria. And what happens is you're taking the substrate, bacteria fermented, produce hydrogen or methane gas. That's absorbed into your circulation, that's carried to your lungs, and you're breathing it out. And that's a timed event. So it's a really easy to do at home test where you basically do a prep diet for 1 or 2 days, depending on if you're constipated. It's recommended that you do the prep diet for 2 days, not just one day. And then you have an overnight fast, and in the morning you do the test. And it's basically you consume the sugar and or test substrate, and every 15 to 20 minutes you're sampling your breath in a tube, and that then gets sent to the lab, and we can determine from at this timed event where in this 3-hour breath test your gases, if at all, have risen, and that can give us the indication of methane SIBO or EMO or regular SIBO, which is hydrogen dominant.
Thank you. And then what about findings on a stool test? So let's say a practitioner orders a stool test because this patient has IBS. So they're first kind of looking in the colon before they, consider doing a SIBO test. What other kind of clues on a stool test might lead the practitioner to know that SIBO should be next explored?
Yeah, and it's really important to preface this by saying that a stool test cannot diagnose SIBO, right? So It's not like you can do a stool test and E. coli is high and therefore say, oh, E. coli often also causes SIBO, therefore this person also has SIBO. It's just not possible to do that. The bacteria in the stool are very, very different from the small intestinal ones. So, but there are a few, I'd say also sort of kind of red flags that would indicate, especially if the symptoms fit, to consider a breath test. Next would be if your patient has very high levels of short chain fatty acids, which are microbial metabolites and products of fermentation of fiber. So that could be that it's SIBO, but it could also be that your patient has large intestinal overgrowth, which would then be evident on that CDSA. So that would be my primary one. I sometimes also see people that have higher levels of secretory IgA, which would indicate a leaky gut scenario, and SIBO causes leaky gut. So that could be another potential, but that's not as red flaggy as maybe the short chain fatty acids.
Sure, or the bacteria in general. What about I can never pronounce this, but the Methanobrevibacter.
Methanobrevibacter. Yeah. So the thing about Methanobrevibacter, which is the main species that produces methane, and they are real survivors, and they're actually normal inhabitants of the gut microbiome. It's not that these are pathogens. Really important to remember. And when they're overgrown, they produce methane, and they do that by actually concentrating hydrogen gas. So for every methane molecule, it requires 4 hydrogen atoms. So it can concentrate it effectively, but that causes constipation, right? So it's not uncommon to see methanogens in the stool, but if they're really overgrown, they can cause constipation in the large intestine, and they won't have necessarily been overgrown in the small intestine. In a way, it doesn't matter, because wherever you find methanogens, they can cause constipation. So the treatment would essentially be the same for that.
Well, let's move on to treatment options, and maybe we could start, well, no, let's not start with motility agents. Let's start with diets. So can you kind of describe, I know you've created the SIBO biphasic diet, and kind of tell us a little bit about that, essentially what foods should be restricted and avoided, which I think are kind of most important, and also discuss the elemental diet as the first part of the treatment process.
Okay, so the elemental diet, people should just forget the word diet with that, because it's actually not a diet that you follow. It's an antimicrobial treatment, right? So it's not something that you do in addition to antimicrobial treatment. So anyways, but the primary diet, and the reason I developed the biphasic diet, is because it was very confusing for patients, what to eat, when they're going through treatment, and even people on a strict FODMAP diet were still symptomatic. So what I did is I devised this treatment, which is a 3-month treatment, into 2 parts, which is phase 1 and phase 2. And phase 1 really was aimed at the practitioner seeing this patient for the first time. They're suspecting SIBO, they're ordering a breath test, and they want to just start on the most symptom controlling diet there is, which is, in my opinion, phase 1 of the biphasic diet, which basically is no starches, no allergens, and basically just low FODMAP vegetables and protein. And then they would also do digestive support, because a lot of people do need that, whether that's enzymes or bitters or things like that. And then also just sort of a gut soothing powder, or just to reduce the inflammation a little bit. And what I found when I did that is people already, when they came back the second visit and wanted to review the breath test result, they were already much better. And we had already 2-3 weeks of treatment. So then they were ready for antimicrobials. Because when you have, when you start antimicrobials too soon in an inflamed system, you can actually kind of trigger some bad reactions. So I found that to be more effective. So people then move from phase 1 diet to a more generous diet that includes more grains and more fruit and more fermentable fibers on purpose, because we want to actually feed the bacteria a little bit while we kill them. So it's a tried and proven method to really help not just symptomatic control, but also the efficacy of treatment in general.
Sure. Yeah, I guess that's kind of where I was going with kind of the first part of treatment, is really getting the patient to change their diet. Can you expand on so you referenced, just in case our patients aren't familiar with what low FODMAP vegetables are, can you mention some of the low FODMAP vegetables that are allowed, and then what some of the high FODMAP, more trigger vegetables are?
Mm-hmm. And just from looking at them, you wouldn't be able to tell, right? So they're all part of a wonderful plethora of vegetables. But high FODMAP, let's start with high FODMAP. So high FODMAP, or FODMAP stands for, let's see if I can still do it, but fermentable oligosaccharide, disaccharide, monosaccharides, and polyols. So these are all substances in these foods, not just vegetables, but foods in general, mostly plant-based food, that are very fermentable by bacteria, as the name implies. So top of the list of very high FODMAP food would be garlic and onions. Almost everyone will have some sort of bloating reaction to those 2 foods, but other high FODMAPs would be celery, for example, or green beans. And then in the low category, you have tomatoes and lettuce and kale and bok choy and sort of those kinds of greens. And so you have very innocent looking vegetables actually be the cause of a lot of problems. And so it's always nice to have a list of those really spelled out. And it was, the whole FODMAP movement was instigated by Monash University here in Australia, where I am. And they have really revolutionized this whole idea of FODMAPs for IBS in general. But the problem with staying on low FODMAP diets for a long time is that obviously you are also compromising your normal microbiome that lives in your large intestine, and that's where most of the bacteria are meant to be. And if you stop, well, you're not going to stop feeding them with a low FODMAP diet, but you're not optimizing them. So I always say that even the biphasic diet is a temporary solution for this problem.
Sure. And then can you kind of compare this to the elemental, I don't want to say the word diet, elemental
treatment,
treatment program. Yeah.
Well, the elemental diet, it is called that. I mean, I was just saying it because so many people are confused because they think it's also a diet that you do alongside other SIBO treatment. But what we found is that the elemental diet, which is basically a formula, a pre-digested formula that has free-form amino acids, so not something like hemp or whey or pea protein, but free-form amino acids that have been manipulated in the lab so that they're free-form, very, very easily absorbable. And then it contains glucose and it contains a certain type of oil. And it's this combination of extremely rapidly absorbing substances that provide nutrients for you, the host, but it's so rapidly absorbed that no bacteria or very limited bacteria have access to it before it's absorbed. And the idea is you're basically starving them to death.
Sure.
And it's actually, gas-wise and pre and post testing wise, it's pretty effective with treatment of SIBO.
And what's the duration of that typically?
So typically it's about 2 weeks, and sometimes practitioners extend that to 3 weeks, depending on how somebody's responding. But it is, a treatment where that is all you're consuming is this powder that you mix with water, and you have, depending on your size and weight, you get a certain amount of servings per day that your practitioner will tell you, and that's all you consume, but that and water. And you do that for 2 weeks. And this is why it's often the least favorite option for patients, but it is a very effective one and something I use when other treatments have failed.
I was just going to ask how difficult this is to convince patients to do. I've had a handful of patients do it, but they were my patients who were just all in, wanted to get better, super committed. So I don't know. It sounds like you already answered that in your experience. It is one of the more difficult treatment options.
Well, I think, and I don't know about you, but I see, I see a lot of people that have failed treatment. I get them referred to me, or they find me in that way. And so I see usually people that have multiple food sensitivities and reactions, and so in a very inflamed state and have had a lot of treatments. And so, sometimes the elemental diet is also a great supplement for people that have malabsorption and, just are very nutritionally depleted. So I also use it in that scenario.
Sure. Let's move on to antimicrobials. So as a part of treatment, right? And then I want to get into the different drugs that are available as well. But kind of share with our audience some of your favorite antimicrobials. And maybe we could even break down here. I know this was a big take home for me from your course, was you help to differentiate best antimicrobials for different types of SIBO. Like take home for me, at least what I learned from your course with hydrogen SIBO is to use berberine, right? And more or less with methane, more the allicin or garlic, oregano. So could you again kind of just mention your favorite antimicrobials and then kind of break that down, expand on what I just said for different types of SIBO?
Yeah, sure. I mean, you said it just now. Yeah. So, so, I mean, this is tried and proven, so for hydrogen, in terms of antimicrobials, there's a lot of different combination formulas available. And so this is always, I'm always really hesitant to name exactly what I'm doing because, as you know, there's so many people that self-treat, and I'm always, I see then people that have done months and months of antimicrobials and they didn't have SIBO, or, so I'm always a bit hesitant to do the exact dose or tell you exactly what to do. without the context of what you need to know. But generally speaking, yes, berberine is a wonderful herb that we use very often for hydrogen dominant SIBO. And it's a bit confusing, but allicin, which is an extract of garlic, which I've just told you, garlic is a high FODMAP food.
Right.
But this medicine is actually doesn't contain the fructans that are the problem in whole food garlic. So this is actually medicinal ingredient extracted from garlic, and that's very effective for methane, and so is oregano oil. Again, be careful with these things, because oregano oil, if you do this for months, you will also damage your microbiome, your healthy microbiome.
Sure.
So yeah, so those would be my 3 top favorites. Yes.
And what about for hydrogen sulfide? If someone was tested and found to be positive there, what are your favorites for that?
Oregano oil is also very helpful for that.
Yep.
And we sometimes use something called bismuth as a binder for hydrogen sulfide. And then also putting a patient on the biphasic diet, but no animal products in addition to no FODMAPs. So this is because you want to not provide any cysteine and sulfur containing amino acids to these hydrogen sulfide producing bacteria.
Good take home. Okay. Let's move on to medications. So what antibiotics, I don't know how many you actually use in your practice, and I can kind of elaborate here too, but what medications do you use for hydrogen and methane or combined SIBO?
Well, what we usually recommend is if the person doesn't want to do herbs, or if they are sensitive, or they failed herbs, then using typically for hydrogen it would be rifaximin or brand name Xifaxan. That's a pretty good antibiotic that's also tried and proven, has minimal damaging effect on the normal microbiome, but it's very expensive, right? It's very, very expensive. It is super effective for hydrogen. Again, you need to understand what caused your SIBO so that you address that alongside treatment. Otherwise, you are potentially going to relapse. So this is always something I tell my patients as well.
And that's so important.
Then,
yeah, because with SIBO, I just feel like it for many patients, and again, this is what you specialize in. I see refractory SIBO all the time. It just keeps coming back. Patients come to me after having had refractory SIBO. And so I think, yes, getting at the root cause is just so important, because you can't take antibiotics the rest of your life. That's not sustainable.
It's not a good management strategy. No, it isn't. So, and then for methanogens, the recommendation is rifaximin and neomycin, but some practitioners do rifaximin and metronidazole or flagyl, which is more broad spectrum, so more damage to the large intestine. But some people, it always depends on how severe the case is. So that's also done. And, those would be the primary types of antibiotics that would be the treatment. And then for, prokinetics is not something that everybody needs. As I've mentioned, you've got all sorts of reasons why somebody has developed SIBO. And there's this idea that you just put everyone on prokinetics, which are medicines that aim to normalize the motility of the small intestine. But yeah, so you have different versions of, or different prescriptions that are used, something like prucalopride or Resolor. Brand name Resolor is very good. Or you can have naturals like, ranging from herbs like ginger and artichokes to bitters to iberogast. So there's got lots of different things that we consider, but case by case basis.
Sure. I want to go back to the various treatment options just for the listeners so they can kind of hear also the duration. So you kind of already mentioned that elemental diet is only a few weeks. So although it may be difficult, it sounds like it's, a short treatment. Antibiotics are usually, 10 to 14 days. And then the herbal antimicrobials usually take a lot longer. So 4 to 6, I've even treated patients for 8 weeks. Would you agree with that?
Mm-hmm. Yep. Yeah, absolutely. And especially with methane, it's not uncommon to do it for 3 months or more. more, So, but typically with hydrogen, 6 to 8 weeks is a good amount of time before you retest.
Sure.
If you're retesting. Yeah. And I always recommend to retest because it's important to understand if it's totally gone, or, a lot of people still have symptoms remaining, but then you test them and SIBO is actually gone. So that gives you the indication that you've got to look at other contributing factors. Yeah,
exactly. So we just mentioned some antibiotics, but I want to go back to probiotics. As we've kind of mentioned at the beginning of the episode, not tolerating probiotics could be a clue that someone could have SIBO, but yet probiotics are still important. So which probiotics do you use with SIBO?
So I said prebiotics, mostly prebiotics that are a problem. So so probiotics are not often a problem for people with SIBO. That wouldn't be, sometimes they are, but not always.
I definitely have seen it, and I have myself haven't tolerated them, so but in the past.
No, it's
so
true.
For some people,
for some people, but some people have like I have tons of patients who can't tolerate probiotics but don't have SIBO, for example. So it's a bit more complicated than that. But prebiotics, which are basically you can buy them. They're usually sometimes in formulas with probiotics. They're basically the food for the probiotics or for the bacteria. Yeah. Sorry, what were you saying after that?
Well, let's just go back to the strains of probiotics that you do like to use.
So what we now know is that there are really specific strains that have different effects. Well, let me just actually preface this whole thing by saying that when you take probiotics, you are not replacing or reseeding your gut. There's this old idea that we need to change in our thinking, is that probiotics, you can just replenish the good bacteria you've lost when you've taken antibiotics by just taking a probiotic. It doesn't work that way, because it turns out that the primary species, lactobacillus and bifidobacterium, that are in probiotics are just a fraction of your normal microbiome. But what they are basically metabolic response modifiers, and they somehow have this growth effect on other key species of your microbiome. And they can affect things like reduce inflammation or affect motility, like Bifidobacterium lactis HN019. I'm always into research strains so that we know that this is actually something that has been shown in research to be effective, rather than just a combination of random strains. So I have that. Then Lactobacillus plantarum 299V has lots of different research on mitigating inflammation, and lots and lots of different things that probiotics can induce, besides this other sort of fertilizing or growth effect that it has on other key species in the microbiome. But they're transient, the effect is only as long as you're taking them.
Yep. Most companies these days, at least to my understanding, and I tell patients this because sometimes they freak out if they miss a dose of their probiotic, and I say that's okay. But the organisms are only going to last in your system a couple weeks, and then they're gone. So if you want those effects, you do need to continue to take them.
Right, and I usually recommend, also rotating your probiotics. That's like with most things, I like to rotate substances and probiotics, and I'm not somebody who just puts somebody on something for a year and that's it. Sometimes that is required, but most of the time I do rotate things based on need.
Agreed. This brought up another question. Immunoglobulins, I know they really helped me when I had SIBO. Do you use many of the serum-derived immunoglobulins with your SIBO patients?
I do. Yeah. Well, I do bovine serum immunoglobulins. This is a great little immune booster, but I also do the IG26, which are the egg-based immunoglobulins. Mm-hmm.
Okay. All right. I want to briefly, I feel like we have to mention SIFO because we've spent so much time on SIBO, but many patients who have SIBO also could have SIFO. And there's a lot of a lot of overlap with symptoms there. But can you expand kind of on what that is and what maybe, differentiates that? And then we can talk just briefly about some treatment options for that too.
Yeah, and I would say SIFO is probably way more common. There was one study from Dr. Rao a few years ago that showed that about 25% of patients that he tested, and this was through duodenal aspirates, that he found that they had SIBO alongside SIFO. That was about 25% of people that were comorbid with those two conditions. But I think it's really, really common because if you think about it, Candida is a really normal organism. So what we're talking about, SIFO stands for small intestine fungal overgrowth. And fungus is just really, really common when we think about how much we're exposed to antibiotics. And, fungal overgrowth is a natural consequence to overuse of antibiotics, whether that's through oral prescription or just eating a lot of meat that has not just hormones but antibiotics, because antibiotics are used in fattening up livestock. So this is something we also consume, and it really has this massive effect on our microbiome that keeps normal fungal colonies in check. And so either that or the immune system is down, and fungus can proliferate, and it's mostly Candida species in the gut. And they love a warm, moist environment, whether that's behind your refrigerator or in your gut. It just is, fungus loves us, so it's one of those fungal species that can survive very, very well in our gut. And especially if we feed it a lot of sugar, a lot of simple carbohydrates, a lot of processed foods, fungus loves that. And so you can imagine that a lot of people probably, even, they might test negative for SIBO, but they have all the classic SIBO symptoms. You might want to consider that they actually have a case of SIFO. So that would then mean that you don't have to be as strict with your fermentable carbohydrate restriction, but you do want to restrict sugars and alcohol and simple carbohydrates and those kinds of things whilst you treat with antifungals.
Yes. And I remember you saying, I believe, patients who have, patients who have SIFO can have similar symptoms as SIBO, right? But they may also have brain fog. They may have this history of rashes or obvious yeast infections, or, that maybe that patient that can't tolerate the sugar. Those could be, I keep coming back to the word clues or cues in this show.
Yeah,
but
they might be.
Yeah, that SIFO could be a problem for that patient. So then you already kind of mentioned.
Another time, right? Or I often see people that say, I had, let's say, sinusitis or something. I got all these antibiotics for it, and my gut's never been the same since.
Right.
That would be a big clue for me.
Right.
So and that I see a lot of that.
And then you already kind of alluded to the treatment options being, probably natural antifungals. Do you typically use botanicals, or sometimes do you use antifungal medications for these patients?
I do. I do all of that. I do different types of antifungals. If they can get a prescription for nystatin is a great little antifungal that's works really well, is very safe, is not absorbed into this, that doesn't cause any liver problems, and it can be used long term. I prefer that because it has very minimal impact on the microbiome, for example. And then lots of different herbs can have antifungal activity, or your things like caprylic acid, andesanoic acid, monolaurin, all of those different things can help. But it's really about reestablishing normal controls in the gut, which means a microbiome restoration type approach.
Sure. So I'm glad we went over SIFO. I want to, as we wrap up the show, ask you a couple extra questions moving away from SIBO. I know in the opening of the show, you mentioned how important the microbiome is just to inflammation and, longevity. Well, I should say reducing inflammation and to longevity, but can you kind of mention the gut-brain connection? And so how important gut health is in relationship to mental health, just quickly?
Yes, so the gut-brain axis has been, that's another whole long topic, but it is basically how the central nervous system is connected to the digestive tract, because the digestive tract actually has a nervous system all on its own that is sort of independent of the central nervous system, called the enteric nervous system. But the central nervous system gets constant messages from the gut in terms of microbial metabolites. The microbiome also produces neurotransmitters, for example, and neuropeptides. The microbiome secretes cytokines to stimulate different inflammatory conditions. So it constantly updates the central nervous system on the state of the digestive tract and whether or not it should respond to a certain thing, a certain situation. So this, is the subject of intense research and ongoing research, because it turns out that it has a much more central role than previously believed, that these microbes really have a very important function for our health and well-being that is beyond just digestive health.
Yes, wonderful. Now, we mentioned at the beginning of the show that one of the root causes of SIBO could come down to stress. And I know a lot of my listeners, a lot of us are dealing with stress. So I'd love for you to mention some of your kind of vagal tone exercises, just kind of to help with stress management. Could you share some of those with us?
Vagal tone exercises are just one aspect of mitigating stress, right? So that is not the one size fits all for somebody who, I see a lot of people that have had very traumatic events occur to them, that have a very dysfunctional limbic system response, that are stuck in fight or flight, and their fear center is just chronically activated. And you cannot do vagal tone exercises alone with them. They're going to need a little bit more work on and maybe do trauma work. And there's like a whole subset of treatments that are based on either adverse childhood events or ongoing trauma, and that would be like somatic experiencing or the EMDR. Those types of therapies are really specific for people with trauma, and oftentimes I refer for that. If somebody has had, for example, let's say traumatic brain injury, they had an accident, then yes, maybe vagal toning is really appropriate for them. And that could be anything from, there's whole books and exercises based on eye movement and breathing and toning like that, or different apparatuses. Some people respond really well to get into a parasympathetic nervous system response or rest and digest with hypnotherapy or tapping or anything like that, that just downregulates the nervous system and helps to reset. But if you look at the whole polyvagal theory, it's a whole nother topic, because it's not just as simple as vagal toning, and I always tell people about that, because so many people are frustrated with the gargling and the humming and the this and the that, and they're not really having any kind of impact on their digestive health. So it just means that this is a much bigger topic. Don't be discouraged if you've done that and you haven't gotten anywhere. It just means you have to look maybe at different types of modalities that might be more appropriate for you.
Sure. And then what role do toxins play in gut health?
This is obviously something that is also a much bigger topic, but basically we are consuming, if you're not eating a very clean and healthy diet and not making an emphasis on organic foods, then it's, chances are you are consuming a degree of pesticides and fertilizers and other substances that directly impact your microbiome. And glyphosate would probably be on the top of my list for that, which is the active ingredient of Roundup. So that's one aspect, is just getting it in through the food. And then also different types of plasticizers and solvents and those kinds of toxins that make their way potentially into our food chain, but also consuming it through water bottles, and like plastic water bottles, plastic wrap, styrofoam, that kind of stuff. And those kinds of what we call xenoestrogens, or chemicals that can act like estrogen and other types of endocrine disruptors, can actually affect your microbiome as well. So those kinds of when you look at everything that impacts the microbiome, it's really no wonder that a lot of us are walking around with a severely compromised microbiome. So it's beyond just SIBO, but it's, this is why I always emphasize, once you've treated SIBO, once you've treated your underlying cause, the work begins on restoring your microbiome as much as possible.
Yep, totally agreed. I know I was trying to cram a lot into the show, so some of these questions is just hard to answer in 2 minutes. But I do tell my patients, 3 major things can impact their gut health. Obviously, the foods they're eating, having gut infections, and then toxins as well. So yeah, we crammed a lot in here. For those who are listening, I do highly recommend, especially if they're practitioners, that they take your SIBO practitioner course. I know one of our other nurse practitioners here already signed up for it, and it just dives into so much more. Like all of the elements that on the show where you're saying this is a larger topic, right? You dive into that, into genomics and LIBO and SIFO, and I think if I remember right, mast cell activation issues and parasites and whatnot, not just SIBO. So it was a great course. So maybe let's go there. Yeah. Tell listeners where they can find you and even that course.
Yes, so my main website is thesibodoctor.com, and I have a patient course for a SIBO patient course. That's a self-guided course where I recommend different products and different treatments and different therapies. And I put a lot of effort, same as with the mastery course, and you learn a lot about everything from leaky gut to food sensitivities to all these different peripheral issues that we see with SIBO. And I have a lot of other practitioner courses on there. And as you mentioned, the SIBO Mastery course, which is a really popular practitioner course. And then you get listed in the SIBO treating practitioner database. So there's lots of different courses as well, pediatrics and liver and gallbladder, and lots of different courses that really help the practitioner understand these functional digestive issues a bit more.
Yes, I want to take that one too. So the SIBOdoctor.com for the listeners. And then social media, are you on social media?
Yes, I have an Instagram is it's a long one. Maybe put it in the show notes, but it's dr.nirala.jacobi _ the SIBO doctor. And then also the SIBO doctor on Facebook.
And you have a podcast. I almost forgot to mention.
I have a podcast. Yes, thank you. Yes, I have a podcast called the SIBO Doctor Podcast, and we are in our 6th year of recording.
Wow.
So it's been a long-standing, great tool for me to also interview people that have really inspired me and I'm super fascinated with. So it's been wonderful to have as a resource as well for practitioners.
Yeah, I agree. It's a great resource. All right. So last question. What's your absolute top longevity tip if you had to pick one?
I would say understand the nervous system in terms of what helps you regulate your own nervous system. So, and I can only give myself as an example. I was always a type A sort of personality. And at some point I had an epiphany that I'm just not meant for the city. And I moved into the, moved to the country. And that was a game changer for me. And my whole nervous system was able to relax. And that is a simple one for some people, but some people have a lot of work to do with trauma, or they have a lot of, other aspects of mental health issues that really affect their digestion. And I think if you can really dive into that and come to a place of serenity and peace, this has such far-reaching effects, not just on digestive health, but on every
overall
aspect of
body
your health.
Yep.
Yes.
What a great way to conclude the show, kind of back to how we opened the show. This was great. Thank you so much for coming on today and really raising awareness of SIBO and helping providers like myself not miss SIBO in their patients. I've learned so much from you. So it was an honor having you on the show today. Thanks so much.
My pleasure. Take care.